Welcome dear students. In this video, let us learn about atrophic rhinitis. Atrophic rhinitis is one of the types of chronic rhinitis. Atrophic rhinitis is also known as Ozena. It's another name for atrophic rhinitis. Ozena is a Greek word that is a synonym of atrophic rhinitis. So the most characteristic feature of atrophic rhinitis is atrophy of the nasal mucosa and turbinates. As the name suggests, there is atrophy of nasal mucosa and the turbinate bones of the nose because of chronic inflammation. It is characterized by atrophy of nasal mucosa and turbinates. So when there is atrophy, the nasal cavities become very roomy and also there is foul smelling discharge. This is a very important point of atrophic rhinitis. The most characteristic clinical feature when you see a patient of atrophic rhinitis is a foul smelling discharge and also crusting of the nasal cavities. So let us learn in detail about atrophic rhinitis. First, its etiology. The exact etiology of atrophic rhinitis is unknown. When the exact etiology is unknown, we formulate various theories to get an understanding about the causative factors. To understand all of the theories, please listen to the small story. There are two girls named Lucy and Mary in a white family in the United States of America. They live among a family of 6 members. They have 4 brothers and also a single mother, and they're working very hard to make ends meet. And Lucy and Mary are both about 13 to 14 years old, and they come to your clinic as cases of atrophic rhinitis. Now with this background, the various theories that we have understood are: first, Lucy and Mary are 2 girls with 4 brothers. What does this suggest? That the disease has female preponderance. With this thought, we have got an idea that maybe there is some endocrine influence. And second, in a single family, 2 of them are affected. So there is a thought that there could be some genetic or hereditary factors involved. And both of them are about the age of 13 to 14 years old. And I said, they are struggling hard to make ends meet. This indirectly suggests that there could be some nutritional deficiencies in the children. And also the very first statement that we have learnt is they are belonging to the white race. So there is some racial factor also involved. So let us write down one by one. First is hereditary factors. Why hereditary factors? Because people of the same family are getting involved. Second is endocrine role. What made us think there could be some endocrine relationship is females are affected more than males, and also this disease is usually seen, it begins at the time of puberty and it resolves by menopause. Not completely resolve, it might come down by menopause. So it is seen in this duration. It is seen in females and also it is seen in this age group. So probably there could be some hormonal influence. Third is racial factors. It is seen more in white race and yellow race than the native Africans. It is seen in white and yellow races. Another theory that has been proposed is nutritional theory. In people suffering with some nutritional deficiencies, such as vitamin deficiencies, iron deficiency, vitamin A, vitamin D, iron deficiency, they are also predisposed to atrophic rhinitis. Another theory is infective theory. In the patients of atrophic rhinitis, when their nasal swabs were taken and cultured, certain bacteria were found, and some of them are Klebsiella ozena. It's also called as Perez bacillus, diphtheroids, Proteus vulgaris, E. coli, and of course staph and strep species, Staphylococcus and Streptococcus species. Now, in spite of finding all these bacteria in the nasal cultures, still this is not the primary cause of atrophic rhinitis. What has been implied is, in a patient of atrophic rhinitis, all these bacteria are actually secondary invaders. But still they are important because it is usually due to these secondary infections that the foul smell of atrophic rhinitis occurs. They are responsible for the foul smell. They are mostly not the primary cause, but they are all secondary invaders in a patient of atrophic rhinitis. Another theory is autoimmune theory. What the autoimmune theory says is, antibodies are present against the antigens of nasal mucosa in patients of atrophic rhinitis. So, antibodies against the antigens of nasal mucosa will destroy the nasal mucosa and eventually cause atrophy. So, what we find is antibodies against nasal mucosal antigens. Now, why these antibodies occur is exactly not known. Probably after a viral infection, maybe those viral antigens are mimicking the nasal mucosal antigens. That is one common probable cause. Or any other factor can lead to this autoimmunity. So, these are the 6 proposed theories: hereditary factors, endocrine factors, racial factors, nutritional deficiencies, infective causes, and autoimmune causes. Very famously remembered with the mnemonic hernia, H-E-R-N-I and A. Even if you do not remember the case study or the story told by me, hernia is a mnemonic that comes to your help. After having studied the etiology, now let us look into the pathology of atrophic rhinitis. What exactly is happening? Normally, the nasal mucosa, as we all know, is lined by ciliated columnar epithelium. This undergoes metaplasia to stratified squamous type. And not just this metaplasia, there is also atrophy of the seromucinous glands. Along with venous blood sinusoids. And the arteries supplying the mucosa, submucosa and the bone, they all show obliterative endarteritis. So the last part of the artery which is supplying all these structures undergoes obliteration. What we also see is the bones in the nose, that is the turbinates, undergo resorption, and there is widening of the nasal chambers. When all the mucosa, bones, everything is getting atrophied, obviously the cavity will widen and there is widening of nasal chambers. Now what do you expect of the paranasal sinuses? The nose shows atrophy and widening, but the paranasal sinuses are small. Please remember this. Do not think just like the nose, even the paranasal sinuses are widened. No, paranasal sinuses are small. Why are they small? Because their development is arrested. This is the pathophysiology of atrophic rhinitis. Now, let us look into the clinical features of atrophic rhinitis. As we have already studied, this is a disease seen more in females than males. It usually begins at the time of puberty, and the most characteristic feature is foul smell from the nose of the patient. It is very problematic. The smell is very foul and the patient becomes a social outcast because of this foul smell. It hinders their day-to-day life and progress. But a blessing in disguise is the patient does not experience that foul smell, and we call this condition as merciful anosmia. Everybody else around the patient can feel the foul smell, but the patient himself or herself is not aware of this foul smell, and we call this as merciful anosmia, and it is a characteristic term. Merciful anosmia in the question, they're pointing towards atrophic rhinitis, because foul smell of the nose is also seen in foreign body of the nose in a child. But merciful anosmia means it is a case of atrophic rhinitis. Then the patient experiences nasal obstruction. Now this might seem paradoxical because in a case of hypertrophic rhinitis, if you say nasal obstruction, it is expected because the turbinates have hypertrophied and there is narrowing of the passage. But in atrophic rhinitis, it is the opposite. The turbinates have atrophied and there is widening of space. The nasal cavities are very roomy. But still, in spite of this, why is the patient experiencing nasal obstruction is the question. Because of the roomy nasal cavities and drying up effects, into the nose, crusting occurs. And these crusts will make the patient experience a sense of nasal obstruction. And these crusts are sometimes very large, and if you attempt to remove the crusts, it can cause bleeding also. So from the side of the patient, these are his only complaints. On examination, what we see is there is a greenish or a grayish black, greenish or grayish black dry crusts covering the turbinates and the floor of the nasal cavity. So the moment you examine the nose of the patient, the first thing that we find is greenish or grayish black dry crusts that are present all over. They are covering the floor of the nasal cavity, and also they are present on the turbinates. And removal of the crusts, if you attempt to remove the crusts, it may lead to bleeding. The crusts may bleed, and bleeding of the nose is called as epistaxis. So if at all you remove the crusts successfully, they are soft crusts or they are small. After removal of the crusts, what we find is it is totally empty. There is a lot of empty space. There is so much of space and it is so roomy that you can actually see the posterior wall of nasopharynx. Imagine from the nasal cavity you are able to see the posterior wall of nasopharynx. It is that roomy. Pharynx can be seen. Nasopharynx can be seen. And what else we observe is the mucosa is pale. And sometimes septal perforation is also possible. And if septal perforation occurs, that will lead to saddle nose deformity of the nose. And the nasal vestibule shows dermatitis. Dermatitis of nasal vestibule. Now this is all pertaining to the nose. Sometimes this atrophy can also extend into the pharynx, and it can extend into the pharynx and cause atrophic pharyngitis. In atrophic pharyngitis, the pharyngeal mucosa also becomes pale and it is atrophied. And sometimes it can also cause atrophic laryngitis. It can extend all the way up to the larynx and cause atrophic laryngitis. In atrophic laryngitis, there is hoarseness of voice and also cough. And obstruction to the eustachian tube can occur. And what does obstruction to the eustachian tube mean? It means that the middle ear is not ventilated adequately. If middle ear is not ventilated adequately, it causes middle ear effusion. and middle ear effusion will lead to hearing impairment. Now you need to know of this entire sequence because sometimes a patient of atrophic rhinitis by the time of presentation itself can have hearing impairment. And this is the reason behind that hearing impairment. He can also have hoarseness of voice and cough. And then we need to check for atrophic laryngitis. So these are all the clinical features of atrophic rhinitis. And if it extends, it can cause these three symptoms also. Now, this disease can persist for years. Sometimes it can spontaneously resolve after many years during late middle age, that is at the time of menopause. And other things that we observe are the paranasal sinuses, as I have already told, they are small and underdeveloped. If you look at the X-ray, they appear opaque on the X-ray. Their walls are thick. The bony part is thick. They are small, underdeveloped with thick walls. The sinus itself is small. So these are the clinical features. Now let us look into the treatment of atrophic rhinitis. There is no complete treatment, that has to be understood. But what we do is, we can divide our treatment into medical and surgical. So under medical treatment, what we do is, first the aim of our medical treatment is to maintain nasal hygiene. We try to remove the crusts and prevent the formation of further crusts. That is the aim. And for that what we do is, first, nasal irrigation is performed. And this nasal irrigation will lead to removal of crusts. And nasal irrigation can be done with warm, normal saline, or we can prepare a solution, an alkaline solution that contains sodium bicarbonate 1 part, sodium biborate 1 part, sodium chloride NaCl 2 parts. These are all put in 280 ml of water. Sodium bicarbonate, sodium biborate, sodium chloride in the ratio of 1:1:2 in 280 ml of water. This is all an alkaline solution, and when we apply this alkaline solution, what it does is, it will loosen the crusts. It will soften the crusts, and also it will remove the thick, tenacious discharge that is present. And also it will prevent further crust formation. These are the 3 advantages or uses of using this alkaline solution. So initially we have to use the solution twice or thrice a day, and slowly as the crusts soften and they are slowly removed, then we can even use them twice or thrice a week. Then the second thing that we do is nasal irrigation with warm saline or the solution is done, Then after irrigation, we paint the nose with 25% glucose in glycerin. We take glycerin and put 25% solution of glucose in it and paint the nasal cavity with this solution. After irrigation, paint the nasal cavity with this. The role of this solution is it inhibits proteolytic organisms. These proteolytic organisms are responsible for the foul smell in a patient of atrophic rhinitis. So 25% glucose in glycerin solution will inhibit the proteolytic organisms. So consequently, the foul smell will come down. Next, what we use is some antibiotic solutions locally. Drops locally. You get a preparation that is known as chemicetine. Chemicetine anti-ozane solution. This contains chloromycetin, estradiol, and vitamin D2. Now this solution has shown a lot of benefit. It will also prevent crust formation. This solution has been shown to be beneficial by preventing crust formation. Another thing that we use is estradiol spray. What does estradiol do is, it increases the vascularity. And when vascularity is increased, there is a chance of regeneration of the seromucinous glands. Regeneration of seromucinous glands. And there are a few other agents that have been found to be beneficial, and they are placental extract, systemic use of streptomycin 1 gram per day for 10 days. Systemically if it is used, this will inhibit Klebsiella. So that's also effective. And also potassium iodide is found to be beneficial. What potassium iodide does is, it liquefies the nasal secretions. These are some of the medical treatments used, but none of them provide 100% relief to the patient. At the same time, they are very beneficial. There is a lot of resolution of symptoms and relief to the patient. Now, the next mode of treatment is surgical. The surgical treatment that is offered is something called as Young's operation, Young's surgery. In Young's surgery, what is done is, both the nostrils are closed. From the vestibule, a small flap of cartilage is picked up and both the nostrils are completely closed. For a period of 6 months. And after 6 months, when we reopen the nostrils, what we find is there is regeneration of mucosa and the crusting has reduced. Now there is another variant of it that is performed, and that is modified Young's operation. Because complete bilateral closure is uncomfortable for the patient, what we do is we only partially close the nostrils and reopen them after 6 months, and almost the same effect is seen. The mucosa is regenerated nicely and the crusts are also all removed. There is another surgery that is done. Now the main problem is there is widening of the nasal cavity. It has become very roomy and that is leading to crusting effects. So we can narrowing of the nasal cavities is another procedure that can be done, and this prevents crusting effects, and narrowing can be done by various methods such as submucosal injection of Teflon paste. This will narrow the nasal cavity, or we can insert fat, cartilage, bone or anything like that. Insertion of fat, cartilage, bone or even Teflon can be inserted. All these will result in narrowing, and also medial displacement of lateral wall of the nose can be done. Surgically, the lateral wall of the nose can be medially displaced. These are the three methods of narrowing the nasal cavity. With this, we complete the treatment of atrophic rhinitis. This entire thing is primary atrophic rhinitis. There is another condition called as secondary atrophic rhinitis. In some infections, specific infections such as syphilis, leprosy, and some conditions such as lupus, rhinoscleroma. These are all some specific conditions which will lead to the destruction of the nasal structures. They will cause destruction of nasal structures. And this will lead to atrophic rhinitis. Some other causes that can lead to secondary atrophic rhinitis are long-standing sinusitis, radiotherapy of the nose for some other reason, and also excessive surgical removal of turbinates. In hypertrophic rhinitis, we surgically resect the turbinates, and if at all they are excessively resected, that will again lead to roomy nasal chambers and crusting. So excessive surgical removal of turbinates is a secondary cause of atrophic rhinitis. There is another variant that has to be learned, and that is unilateral atrophic rhinitis. So far, whatever we have learned occurs bilaterally, but there is a condition called as unilateral atrophic rhinitis, and when this occurs is in a case of extremely deviated nasal septum. Then one side is very roomy, one nasal chamber is very roomy, and that roomy side shows features of Atrophic rhinitis. It becomes dried up and crusted. Now DNS can result in both things, hypertrophic rhinitis as well as atrophic rhinitis. The roomy side can either show compensatory hypertrophy or it can show features of atrophic rhinitis also. If it shows features of atrophic rhinitis, we call it unilateral atrophic rhinitis because all these features are seen only on one side, the roomy side. With this, we complete the topic of atrophic rhinitis. Let me quickly revise this for you. It is one of the important topics for exam, both in terms of theory exams as well as multiple choice questions. So what we need to remember about atrophic rhinitis is it is characterized by atrophy of the nasal mucosa and turbinates, and the exact etiology is unknown, and also the exact treatment, 100% treatment that works is also not there. So it's a kind of dreaded disease. So the theories proposed are hereditary, endocrine, racial factors, nutritional deficiencies, infective causes and autoimmune causes. Infective causes are usually, these bacteria are usually secondary invaders which are more responsible for the foul smell rather than the disease itself. And what is happening is the ciliated columnar epithelium is undergoing metaplasia into stratified squamous type, and there is atrophy of seromucinous glands, venous blood sinusoids also narrow down, and also the arteries which are supplying the mucosa, submucosa and the bone, the end arteries get obliterated. They show obliterative endarteritis. And the bone shows resorption, and there is widening of nasal chambers. The paranasal sinuses are small. Please remember this. They are small and underdeveloped. Clinical features of this disease are it affects females more than males, and the disease usually starts at around puberty, and there is a foul smell which the patient himself doesn't know, but it is felt by people all around, and this hampers the social life of the patient. But because the patient himself doesn't know about this, we call it merciful anosmia. And another very important feature that the patient experiences is nasal obstruction, and this obstruction is because of crusting. And on examination what we see is greenish or greyish black dry crusts that are covering the turbinates and floor of the nasal cavity. And if we try to remove the crusts, they may bleed and cause epistaxis. But after removal of the crust, what we see is the nasal cavity is so roomy and the turbinates are so atrophied that we can actually see the posterior wall of the nasopharynx. And the mucosa is pale, and all this crusting and atrophy can even cause septal perforation, and septal perforation will give rise to saddle nose deformity. And dermatitis of the nasal vestibule is seen. Sometimes this atrophic rhinitis can extend to other areas and cause atrophic pharyngitis, atrophic laryngitis, and it can also cause obstruction to the eustachian tube, which will lead to middle ear infusion and eventually hearing impairment. The paranasal sinuses, as we have already discussed, are small and underdeveloped with thick walls, and on an X-ray they appear opaque. Treatment is both medical and surgical. Medically, what we do is nasal irrigation by applying warm normal saline, or we can prepare an alkaline solution whose composition is important. It contains sodium bicarbonate 1 part, sodium biborate 1 part, sodium chloride 2 parts, and these are all put in 280 ml of water. And this solution will cause loosening of the crust. It will remove the thick tenacious discharge, and it will also prevent further crusting. And after nasal irrigation with the solution, when the crusts have softened and when we are trying to remove the crusts, then we put 25% glucose in glycerin and paint the entire nasal cavity with this solution. This will inhibit the growth of proteolytic organisms that are responsible for the foul smell. And next we can use chemicetine anti-Ozena solution, which contains chloromycetin, estradiol and vitamin D2, and it is very much beneficial. Estradiol spray alone can also be used, which increases the vascularity and causes regeneration of the seromucinous glands. Placental extract and streptomycin, potassium iodide are other substances that are being tried. Then the surgical treatment is by Young's operation, where both the nostrils are closed completely for a period of 6 months, and this will slowly lead to regeneration of the mucosa, and even the crusts are gone by the time we open the nose again. But because this is uncomfortable for the patient, we can do modified Young's operation, wherein the nostrils are partially closed. We can also surgically cause a narrowing of the nasal chambers by submucosal injection of Teflon paste or inserting fat, cartilage, bone or Teflon into the nose, or medialization of the lateral wall of the nose. These are the surgical procedures that are done for atrophic rhinitis. Secondary atrophic rhinitis is a condition where, because of certain infections such as syphilis, leprosy, lupus and rhinoscleroma, the nasal structures are destroyed, leading to atrophic rhinitis. Other causes of secondary atrophic rhinitis are long-standing sinusitis, radiotherapy and excessive surgical removal of the turbinates. Unilateral atrophic rhinitis is another special condition that is seen, wherein the extremely deviated nasal septum will lead to atrophic rhinitis-like changes on the roomy side of the nose. So this is all about atrophic rhinitis, which is a form of chronic rhinitis. It is a subtype of chronic rhinitis. Thank you very much.